Everybody, welcome to Commonsense Urology, where I'll be going over common urological problems and offering sensible approaches to diagnosis and management. I'm Dr. Neil Gordon, and today's episode's entitled Routine MSU, a routine waste of time and money. Now, what do I mean by a waste of time and money? Well, as you would know, Mid-Stream Urine Specimen is what MSU stands for, and it's exactly that. The patient is required to pass urine down the toilet first of all, and then a small amount into the jar, approximately half full, and then the rest down the toilet. It's what happens with that specimen next. If you just send it off to the laboratory, it's going to take about 2 days for a result to come back for a culture and sensitivities, if an infection is present. If an infection is not present, you don't need the lab to tell you that. So instead of sending it all off to the lab, what I do is I use a Clinitek Status Plus analyzer. It takes the coloured sticks, and in 2 minutes you'll have a result that tells you whether or not you should send it off to the lab at all. This is what the machine prints out as a result. Now, if you look at the flow diagram which I've supplied here, you'll be able to see whether or not you need to send anything off to the lab at all. Clearly, there are times when further investigation is needed, and as the flow diagram shows, there are times when you should give the patient empirical antibiotics. There are times when you need to wait and see what culture turns up, and therefore prescribe the appropriate antibiotics accordingly. On the right hand side is a plan for hematuria management, and that'll be discussed in a following episode. The empirical antibiotics that I would suggest are nitrofurantoin 50 mg TDS, amoxicillin 500 mg BD, amoxicillin clavulanic acid combination 500 mg BD, or Bactrim, which is trimethoprim sulfamethoxazole combination BD. These seem to be most effective empirically, and they may well be the antibiotic of choice once the cultures and sensitivities are through. Norfloxacin is a useful antibiotic if Pseudomonas is cultured, and ciprofloxacin 500 mg BD is useful for more complicated urinary tract infections when identified. Interestingly, the majority of multi-resistant Staphylococcus aureus infections are sensitive to nitrofurantoin, so do ask your lab to check for that. So in conclusion, in my experience and in my opinion, 2 sets of 3 magic words that you should always listen for in the medical and surgical fields, because a lot of work is based on experience and opinion. Testing the urine with microscopy and culture can be a big waste of time and money if there is nothing found in the urine's initial urinalysis. The urinary analyzer is an extremely useful piece of equipment and not terribly expensive. Every general practice would benefit from one, and certainly every specialist urological practice would also. It is possible to test for more things than the 8 that we use, but we only test for the things that we need. And I think that's not a bad principle in any practice of medicine or surgery. This is not sponsored by SIEMENS, who make the Clinitek Status Plus analyzer. However, I would recommend it to save a lot of time and a lot of money. If you've enjoyed what you've seen and heard in this short episode, please consider giving a thumbs up, and also consider subscribing, and don't forget to click on the notification bell to hear about more episodes to come. Cheerio.